Have you ever looked at your hands after a long shift and barely recognized them? Red, cracked, burning. That's not just dry skin. That could be contact dermatitis. Let's talk about it. Contact dermatitis is skin inflammation caused by something touching your skin, a chemical, a substance, an irritant. It's one of the most common occupational skin conditions in the world, and it's almost entirely preventable. There are two main types. Irritant contact dermatitis happens when something damages your skin directly. Think detergents, solvents, cement, or constant hand washing. Allergic contact dermatitis happens when your immune system reacts to a specific substance, like latex, nickel, certain resins, or hairdressing chemicals. Same red, angry skin, different cause underneath. So who's at risk? Picture a nurse scrubbing in 15 times a day, a mechanic with hands soaked in grease and solvent, a hairdresser mixing dye after dye, a construction worker's palms coated in wet cement, a cleaner whose gloves trap moisture against irritated skin for hours. If your job means repeated contact with water, chemicals, or friction, you're in the risk zone. Now, picture what this actually looks like on skin. Cracked, bleeding knuckles that sting every time they bend. Palms covered in tiny blisters, oozing and crusting. Skin so dry and thickened it looks like tree bark. Angry red patches spreading up the forearm. It can itch relentlessly, burn, and even become infected if the skin barrier stays broken. This isn't just uncomfortable. It can affect sleep, grip strength, and confidence at work. So how do we protect our skin? First, barrier protection. Gloves matter, but the right gloves matter more. Match the glove material to the hazard you're actually facing. Second, moisturize like it's part of your job, not an afterthought. Apply barrier creams before exposure and rich moisturizers after. Hydrated skin resists damage far better than dry skin. Third, reduce unnecessary exposure. Rinse thoroughly, dry completely, and avoid prolonged glove wearing that traps sweat and moisture against skin. Fourth, report early symptoms. A little redness today can prevent a painful, chronic problem tomorrow. Early action changes everything. Here's your one takeaway. Your skin is your first line of defense at work, so defend it back. Small daily habits, the right gloves, the right cream, quick action on early symptoms protect you for years to come. Want more practical, no-nonsense health and safety guidance like this? Visit healthatwork.solutions to learn more and subscribe to Health at Work for tips that protect you every single day.